We all recognize that it's common to hear people speaking about depression in a casual sense, but there is a significant distinction between the depression many of us speak about, referring to a state of being temporarily sad or low on energy, versus the clinical disorder known as major depression. And we want to take a look at some of the specifics in that diagnosis. First of all, we need to understand that for a clinician, in order to make a diagnosis of depression, we have to identify at least one, what we call major depressive episode. And if a person has one, then they have major depression, a single episode. If they have more than one, two or more, they're referred to having major depression recurrent. It's far more common for people to have one episode of depression, but it's not uncommon for people who've had one to have more later on. So, a major depressive episode means that an individual experiences symptoms for at least 2 weeks, and that these are sustained and happen every day or at least almost every day. And they must have at least 5 of the symptoms we're about to describe. They also must experience impairment or dysfunction in their life as a result of these symptoms. So the symptoms include a loss of pleasure, especially from things that before the episode occurred would normally have derived pleasure for the individual. They may have disturbances in sleep, and as we spoke of earlier, this may mean the person sleeps more or less than they used to, or that they have erratic sleep patterns. They may experience emotional distortion, particularly in the form of sadness or irritability. And some people get confused by this because we often think of the person who's depressed as being sad or emotionally low, when often it can be manifested as irritability, easily annoyed, and angry personalities. The person may have a change in appetite, and again their appetite may actually increase, decrease, or be fluctuating. The person is going to often experience lethargy, a lack of drive, volition, self-care, and feelings of hopelessness. The person is very intractable in this state and doesn't see any purpose in trying to address their emotional needs because they simply don't believe anything can change it. People often describe the feeling of depression as being so severe that it's actually painful for them, and they cannot understand so they cannot wait to be done with it, to the point that people sometimes become suicidal. So it's highly intractable, and people often become suicidal. They ideate or imagine, plan, dream of suicide. There is no known or clear trigger, and in fact, one of the changes we've talked about in the DSM-5 is that the old DSM-4 criteria used to say that there must be at least 2 months or more distance between when something that a person might grieve, a bereavement event, occurred and when a diagnosis occurred. But in the DSM-5, it's evident that psychiatrists will have the ability to make that distinction before 2 months. There's also some consideration of things like, for example, whether a person has excessive worry, a fear that something terrible is going to happen, or whether or not they simply are irrationally worried about things. And it's also possible that the DSM-5 will look at things like other secondary symptoms, such as alcohol use, for example, as an indication possibly of depression. Bipolar disorder used to be lumped in with depressive disorders in a category called mood disorders, but as we spoke of earlier, it is now given its own separate chapter. There are 2 types of bipolar disorder, and the first one is simply called bipolar 1. And it's probably the one that most people think of if they have any knowledge around bipolar disorder at all. And in the old days, it used to be referred to as manic depression. Not the most accurate term because people weren't manic and depressed at the same time. They experience mania and depression in cyclic episodes. And remember, the idea of cycles is very important, that we need to be able to essentially draw some kind of pattern. If you were to look at the individual over a period and track their moods, you would start to see something that looked almost like an oscillating wave. And the person who's manic has this elevated mood that we spoke of earlier, and the person who's depressed is experiencing those same exact depressive episodes we just identified in the last slide. So the manic episode is defined as 1 week or more of elevated mood, again experienced every day or almost every day by a person, and that can come in the form of irritability. And we want to pause for a moment and reflect on the idea that irritability occurs in both depression and in mania, and it can be difficult as a result to see which one of the person's symptoms you're observing. We can have the flight of ideas we spoke of earlier, an extremely high energy level, a lack of a need for sleep, feelings of elevated confidence, and even possible delusions of grandeur or other symptoms of psychosis. And these cycles occur with no obvious trigger. It is simply the passage of time that tends to be correlated with their cycles. There are some people who seem to have cycles that roughly correlate with their seasons, but roughly speaking, there's no specific life event that can trigger a person to suddenly change, although there are some people who seem to be more likely to change under more stressful circumstances. We can continue talking about bipolar disorder and discuss bipolar 2. And in bipolar 2, the person experiences depression in cycles without mania. In other words, they go from depressed back to a stable baseline and back to depression. Or they may go into what we call hypomania. And you recall that a manic episode was 7 days long. A hypomanic episode is 4 to 7 days long. In other words, doesn't quite meet the criteria for mania because it's more short-lived and may not have quite the same severity of symptoms, but the person is observed as being in an elevated mood state for 4 days or more. We also have people who are what we call rapid cycling bipolar individuals, and this means simply that they would go through this cycle 4 or more times in a year. So typically when we're talking about a person with a more typical approach to or more typical diagnosis of bipolar, they're going to have 2 to 3 cycles in a year. However, an individual who has rapid cycling is going to go up and down a total of 4 times or more. And some individuals will actually go through this number of cycles far, far in excess of 4 times or more per year. I've worked with individuals who went through 4 cycles in a space of a week or 2. Now, there are some people who have disorders which are not quite at the degree of mania or of depression, and for this we call the disorder cyclothymia. Cyclo meaning cyclic and thymia meaning mood states. So the person has cyclic moods, but they don't meet quite the criteria for mania nor for depression. And this individual is going to be less obvious in terms of their effects than an individual with true bipolar. And then there's the person who's called a dysthymic individual, and that person has basically a steady baseline rate of depression for an ongoing period of time. They aren't really cycling, they're just never quite coming up to the baseline level. They are only really fluctuating in the levels of their depression on an extended basis. So this is a person who's got a considerably longer episode than 2 weeks.